So let us talk about spinal nerves. We have two major groups of nerves for our nervous system. So we have our cranial and we have our spinal nerves. Pinagkaiba po nila, when we say spinal nerves, this protrudes from the spine or our spinal cord. When we say our cranial nerves later on, mag-originate siya from our cranium. So these arise from the spinal cord from the union of dorsal roots and ventral roots. This contains axons of both sensory and somatic. So it can sense and cause movement. And these are called mixed nerves. They are located in between vertebrae and they are usually categorized by the vertebral column in which they emerge. So we have their cervical, thoracic, lumbar, and sacral and coccygeal. So depending on saan part siya ng spine, nagsisimula, yun ang kanyang number. So I think this was discussed in your skeletal system. So we have 31 pairs, C1 to 8, T1 to 12, L1 to L5, S1 to S5, and CO, isa lang po siya. And they are organized into three major plexuses or plexuses. When we say plexus, it is a bundle of nerves. Bundle or concentration of nerves. Okay, meaning sa isang lugar, madami yung ating nerves. Okay, so we have our spinal nerves right here and our cranial nerves. So for our cervical plexus, this is our first plexus. This originates from spinal nerves C1 to C4. It innervates muscles attached to the hyoid bone, as well as the skin of the neck and posterior portion of the head. It contains the phrenic nerve, which is the most important branch of our cervical plexus since it innervates our diaphragm. Okay, in particular, it controls our diaphragm. So if ever your phrenic nerve becomes damaged, one aspect that may be or lumabas sa inyo is hindi kayo automatically nahinga or hindi nagko-compensate ang ating diaphragm in case of paghinga natin. Okay, so we have our cervical plexus right here, and this is our phrenic nerve, the bottommost portion na nagko-combine. This is our phrenic nerve. Okay, it's only a small part, but it does a very important job. Okay. Next, we have our brachial plexus. This originates from our spinal C5 to T1. It supplies nerves to the upper limb, shoulder, and hand. So if para madaling tandaan, brachial, you have your brachial muscles. It innervates most of your upper limbs. We have five major nerves that are axillary, radial, musculocutaneous, ulnar, and median nerve. Okay, so this originates from your C5 to T1. Next, you have your lumbosacral plexus. It originates from your L1 to S4. It supplies nerves to the lower limb, and we have four major nerves that access the plexus to supply the lower limb. The tibial and common fibular nerves are bundled together to form our sciatic nerve. Okay, so the tibial and common fibular nerves parang nagko-combine siya sa baba. In this case, nasaan ba? Here, which is our sciatic nerve. Okay. What is important with our sciatic nerve is it mostly controls our lower limbs. And damage to the nerve will cause a condition called sciatica, which is nerve type pain in the lower limb. Okay. Also, if you damage your sciatic nerve, it can lead to lower limb paralysis. So yung mga napapalo if ever sasali kayo ng fraternity sa med school bago pinalo ang inyong legs, make sure na sa puwet, hindi sa lower portion ng inyong puwet. Dun sa parang magsisimula ng spinal cord kasi maraming nerves na pwedeng ma-damage. Okay, so this is a breakdown of the plexi or the plexuses in your spinal cord. Okay, another perspective, this time from the back. These are also the use and muscles that are innervated by your major plexuses. Okay, now let's talk about the brain. So let's talk about kung ano yung nakapatong sa ating ulo. So our brain is divided into 4 major regions, namely our brainstem, our cerebellum, our diencephalon, and our cerebrum. Marami siyang parts sa loob, pero ito yung major regions of the brain. Okay, so you have your cerebrum, which is the largest part, cerebellum, which is near the back, the encephalon, brainstem is part in the middle, and the encephalon ay nasa gitna. Okay, so your most prominent part is your cerebrum, which is the largest part of your brain. Okay, so these are the different parts of the regions of your brain. This is the right half part. Okay, if you split it along the line, it would be symmetrical. Okay, so first we have our brainstem, the first region. The brainstem can be found in your lower part of the brain, and it contains your midbrain, your pons, and your medulla oblongata. The main role of your brainstem is to connect your brain to your spinal cord. Okay, and although it is a major connecting part, it also does some functions like control the heart rate, blood pressure, and breathing. Damage to the small area of the brainstem can cause death, okay, because it controls heart rate, blood pressure, and breathing. These are all very important parts in our homeostasis. Okay, so pag tinamaan ka sa ulo ng palo or something, given enough blunt force trauma, it can cause instantaneous death. Okay, you have your brainstem right here. Okay, it's next. Let's talk about the parts going up. We have our medulla oblongata. This is your smallest or the most inferior portion of the brainstem, and is continuous with the spinal cord, meaning wala siyang hati. Diretso siya nakadikit sa ating spinal cord. It extends from the level of the foramen magnum to pons. The main functions is the regulation of heart rate and vomiting and blood vessel diameter, breathing, swallowing, vomiting, coughing, sneezing, balance, and coordination. Although vomiting is connected with your cochlear nerve. So it also has pyramids. May tawag pyramids. These are two prominent enlargements on the anterior surface involved with conscious control of skeletal muscles. Okay, so para madali yung identify sa medulla oblongata, hanapin niyo yung slightly, ito kasi yung brainstem, yung ating midbrain. Okay, pag nakita niyo itong parang matabang part na to, this is your midbrain. Okay, nasa ilalim nun, medulla oblongata. Bago nasa ilalim ng spinal cord. Okay, so ang inyong key identifier is this part here. Then move down. Next you have your pons. Midbrain ba? I think mali ata sabi ko. Pons pala. So this is immediately superior to your medulla oblongata. It is a functional bridge between your cerebrum and your cerebellum on the anterior surface and resemble as an arched footbridge. The main functions is swelling, breathing, swallowing, balance, chewing, and salivation. So you have your pons. Sorry, mali yung sabi ko kanina. Pons yung nasa ibabaw ng ating medulla oblongata. So medyo mas mataba siya ng konti. Pag sa MRI, mas madali siya makita. Next, you have your midbrain, which is the topmost portion of our brainstem. Its main functions is coordinating eye movements, controlling the pupil diameter, lens shape, turning the head towards a tap on the shoulder, on a sudden loud noise, or a bright flash of light. We have what we call colliculi, which is 4 mounts in the dorsal part of the midbrain. The 2 inferior colliculi are major relay centers for the auditory nerve pathways in the CNS, while the 2 superior colliculi are involved with visual reflexes and receive touch and auditory input. We have what we call the substantia nigra, which is a black nuclear mass and is involved in regulating body movements. Meron ba nakasulat? Okay. Something about our substantia nigra. So substantia nigra is actually very much involved in our body movements. Research has shown that persons with Parkinson's disease, which is a mobility type disorder, tend to have less activity in our substantia nigra. In particular, they have fewer acetylcholine receptors found there. Okay, you also have your reticular formation, a group of nuclei scattered throughout the brainstem. It plays important regulatory functions. It is particularly important with cyclical motor functions. When we say cyclical, meaning paulit-ulit, like your respiration, walking, and chewing. It is a major component of our reticular activating system, which plays an important role in arousing and maintaining our sleep-wake cycle. So damage to the reticular formation can cause comas. Okay. Next, you have your cerebellum, the next major part of your brain. It means little brain because it is mukha naman talaga siya maliit na brain. It is found in the back portion of your head. And it is attached to cerebral pedicles to the brainstem. The cerebral cortex is composed of gray matter, gyri, and sulci, but the gyri is much smaller than those of the cerebrum. Later we will discuss the cerebrum. It is involved in maintaining balance and fine muscle tone and coordinating fine motor movement. If damaged, muscle tone decreases, fine motor movements become very clumsy. So this is your cerebellum. Okay. Para madaling hanapin nyo po ang ating pons ulit, or our brainstem. It is directly behind that. And nasa ilalim siya ng ating cerebrum. Next, you have your diencephalons. Your diencephalons are part of the brain between the brainstem and the cerebrum. It is composed of your thalamus, epithalamus, and hypothalamus, although epithalamus is less discussed. Okay, nasa gitna siya ng ating brain. So the thalamus is the largest part of your diencephalon. It is shaped like a yo-yo with 2 large lateral parts connected to the center by a small interthalamic adhesion. It is the main sensory relay center, and it influences mood and registers an unlocalized, uncomfortable perception of pain. Epithalamus is the small area superior and posterior to the thalamus. It is involved in emotional and visceral response to odors. It contains the pineal gland, an endocrine gland that may influence the onset of puberty and may play a role in controlling long-term cycles that are influenced by the light-dark cycle. In animals, it is known to influence behavior such as migration, as well as color and density of furs. Okay, you might be wondering, class, bakit parang hindi sure pag dito sa anatomy and physiology, bakit pag brain ng usapan parang hindi sure ang statement, parang it may play a part? It's because it's not directly observed, or I mean, hindi tayo sure na may ginagawa nga talaga yon. We can only correlate. Para malaman natin kung anong part ng brain ang mainly responsible, what we do is we put a sample patient under the MRI. We ask them to do something, then observe the electrical impulses in the brain. So example, pinagsalita mo siya, may part ng brain na magla-light up because it has increased electrical activity. If meron ding, example, pinag-play mo ng gitara, which is a musical ability, iilaw din yung ibang parts ng brain. Pag may pinagawa ka sa iyong hands, iba't ibang part ng iilaw. Next, you have your hypothalamus. The hypothalamus is much more involved in our body because it maintains homeostasis. It plays a central role in controlling body temperature, hunger, thirst, sensations such as sexual pleasure, rage, fear, and relaxation after a meal. It also controls emotional responses and our nervous perspiration due to stress. Other parts is your infundibulum, which is a funnel-shaped stalk that connects the hypothalamus to the pituitary gland. You also have your mammillary bodies, which form externally visible swellings on the posterior portion of the hypothalamus and are much involved in the emotional responses to odors and in memory. So you have your thalamus, which is the larger part, and you have your hypothalamus over here. Okay. Cross-section wise, ito ang itsura ng inyong thalamus. Okay. So kung kayo ay nag-grad tech, ganito lagi ang inyong tinitingnan. Okay. So the hypothalamus is much more smaller. And the pituitary gland is inferior to our hypothalamus. You have your pineal gland. Okay. We have our mammillary body right here. Baka mahirapan kayo makita. The mammillary body is a bulge. Kaya siya tinawag na mammillary body, it looks like boobs. Okay. Let's move on to our cerebrum. Our cerebrum is the largest part of our brain. It is divided into left hemispheres and right hemispheres by a deep longitudinal fissure. We also have our corpus callosum, which is a mass of white fibers that connects the two hemispheres. This is found beneath our cerebrum. The surface is covered by large folds of tissues called gyri. Large folds meaning tupi. And the intervening grooves and indentations between the gyri are called sulci. Deep sulci are often called fissures pag masyadong na siyang malalim. And these fissures are important because they are landmarks. Okay, so our cerebrum is largely divided into four major lobes. We have our frontal lobe, our parietal lobe, we have our occipital lobe, which is nasa likod ng inyong ulo, and you have your temporal lobe, which is on the sides. Wala naman sa sides, pero yun yung pinaka madaling i-point out. So for our frontal lobe, it is important for the control of motor and voluntary functions, motivation, aggression, mood, and smell perception. Parietal lobe is the principal reception for reception and conscious perception of most sensory information, such as touch, pain, temperature, and balance. You have our occipital lobe, which functions in the reception and perception of visual input. We also have our temporal lobe, which is involved in our olfactory and auditory sensations and play an important role in memory. Its anterior and inferior portion, called the psychic cortex, are associated with functions such as abstract thought and judgment. Okay, so we have another part of of our cerebrum, which is not a lobe; it is a insula. It is found inside the cerebrum, kaya medyo hindi siya natatawag usually. It is buried within a fissure between the temporal and parietal lobes and are often referred to as the fifth lobe. We have our central sulcus, which separates the frontal and parietal lobes, and we have the lateral fissure, which separates most of the temporal lobe from the rest of the cerebrum. Okay, so these are the major fissures that separate each lobe of the brain. So our insula is not found when looking outside. Kailangan mong hatiin yung brain para makita. Okay, ito po siya. Okay, so this is the major portions of our brain, which is highlighted in orange. You have your cerebrum. Okay, so this is the main fissure that divides the hemispheres. Major landmarks. When we say gyri, these are the larger folds. Okay, when we say sulci or sulci, it is yung nasa gaps that were formed by the folds. Okay, again. The transverse fissure, here we go. It divides your occipital. It divides your cerebrum from your cerebellum. Okay, so we have two major hemispheres. We have the right and the left hemisphere. It is theorized that the right hemisphere receives input and controls from muscular activity from the left side of the body and involved in three-dimensional or spatial perception and musical ability. The left hemisphere receives input from your right side of the body and is more on analytical, emphasizing mathematical and speech skills. Yun yung mostly accepted functions. Okay, we have our corpus callosum, which is found. It is a white bundle of fibers underneath your cerebellum. Okay, more images. Okay, next we will be discussing our sensory functions. The CNS constantly receives sensory input. We are unaware of how much the input or how much input we receive. However, it is vital to our survival. Some sensory input results in sensation. So we have two tracks. We have ascending and descending tracks. These are pathways in our spinal cord, and they transmit information via action potentials, which will be discussed in your leg, from the periphery to various parts of the brain. Each track has a limited type of sensor input, meaning para siyang wire na hindi siya pwedeng dala niya lahat ng signals. And usually given composite names that indicate their origin and termination. Kung saan siya nagsisimula at siya natatapos. Most consist of 2 to 3 neurons in sequence from the periphery to the brain. Okay, so you have your ascending track right here. You have your spinothalamic, dorsal column, and spinocerebral. Cerebellar pala. Okay, so these are ascending tracks when you cut your spinal cord in half. Okay, so ito po yung itsura ng ating new track. So usually meron kayong nerve to isang nerve papuntang spinal column, isang nerve from spinal column going to your brain, and from your brain to what specific part of the brain it needs to go to. Okay, we have primary sensory areas in the cerebral cortex. First, we have our primary sensory arrays, which are the specific regions of the cerebral cortex where ascending tracks are projected. These are where sensations are perceived. We also have our primary somatic sensory cortex, also called your general sensory area, located in the parietal lobe posterior to your central sulcus. Ascending tracks project to primary sensory areas of the cerebral cortex. Association areas are involved with recognizing the sensory output. Okay. Next, we have our motor functions. Motor functions include involuntary and voluntary movements. So when we say involuntary, this is occurring without your and when we say voluntary, you will these movements into movements. So upper motor neurons in the cerebral cortex connect to the lower motor neurons in the spinal cord or cranial nerve nuclei. We have major areas of our cerebral cortex dedicated to movement. We have our primary motor cortex, which is located in the posterior portion of the frontal lobe, which controls voluntary movements of skeletal muscles. We also have our premotor motor area, which is located in our frontal lobe, where our major functions are organized before they are actually initiated. We also have our prefrontal area, located in the anterior portion of the frontal lobes, where motivation and foresight to plan and initiate movements occur. Okay, so this is slightly different division of our brain. Earlier, we divided the brain into parts based on their anatomy, like our cerebrum, cerebellum. This division is based on the sensory and motor functions. Next, we have our descending tracts. These project directly from the upper motor neurons in the cerebral cortex to the lower motor neurons in the spinal cord. Indirectly, they project from the basal nuclei, the cerebellum, or the cerebral cortex through the brainstem to the lower motor neurons in the spinal cord. These control different types of movements. Okay, so these are the different pathways on which how movement is transferred from your brain to your different parts of the body. Here is a breakdown of the different parts of the spinal cord going down. And this is an example of your direct tract for movement. So you have your connection from your motor complex to your spinal cord. Then it directs connectly to your neuromuscular junction. Cool. Next, you have your basal nuclei. These are groups of functionally related nuclei. They help plan, organize, and coordinate movements and posture. The two primary nuclei are your corpus striatum, located deep within the cerebrum, and the substantia nigra, which we discussed earlier, is a group of darkly pigmented cells in our midbrain. People with basal nuclei disorders exhibit increased muscle tone and exaggerated uncontrolled movements when at rest. Parkinson's, Huntington's, and cerebral palsy are basal nuclei disorders. So these are disorders that disrupt movement of our body. Okay, so we have speech. Paano tayo nagsasalita? This occurs mainly in our left hemisphere, primarily in our Wernicke area. It is located in the parietal lobe and functions in understanding and formulating coherent speech. We have our motor speech, meaning kung paano tayo nagsasalita, kanina paano tayo mag-intindi. It is located in our frontal lobe and controls movement necessary for speech. Okay, so when we say you have aphasia, it is absent or defective speech or language comprehension due to damage of the Wernicke and Broca areas due to associated brain lesions. Okay, we have different types of brain waves. These are used to diagnose and determine treatment for brain disorders. We use our electroencephalogram or our EEG to monitor brain waves, which are a summation of electrical activity of the brain. Okay? Baka malita kayo sa EEG at ECG. EEG is for the brain. ECG is for the heart. So you have four types of waves. You have alpha, beta, delta waves. delta and theta waves. So alpha waves are observed in normal persons who are awake but in a resting position. We have your beta waves, which occurs during intense mental activity. You have your delta waves, which is occurring in deep sleep in infants or patients with severe brain disorders. And last, we have our theta waves, which are usually observed in children, but they can also occur in adults who are experiencing frustration or who have certain brain conditions. Okay, next we have memory. So how do we have memories? So the storage of memory can be divided into three major parts. We have our working memory, short-term, and long-term memory. When we say working memory, it is kumbaga, the shortest span of them. But it is easily learned, also easily forgotten. It is called task-associated memory. It only lasts a few seconds, 2 minutes, and occurs mostly in our frontal cortex. It is limited primarily by the bits of information that can be stored at any one time. So a good example of this is pag inutusan ka na may kunin, pag tapos na yung iyong task, makakalimutan mo na yung ginawa mo. Or ano yung pinagawa sa iyo or anong pinagawa sa iyo. Maalala mo yung pinagawa sa iyo pero hindi mo alam kung how you exactly did it. A good example of this is also kapag nagdra-drive kayo. Ilang taon ba kayo? I think you're 19, 18 already. So if you can drive already, it occurs na nagdra-drive kayo along the road, then pagdating mo sa destination, you forgot all about driving. So ito yung working memory. So when new information is presented, old information previously stored in working memory is eliminated. Next, we have our short-term memory. It lasts longer than working memory and can be retained for a few minutes to a few days. It is stored by a mechanism involving increased synaptic transmission, susceptible to brain trauma such as physical injury and a decreased oxygen, and to certain drugs that affect neural function such as general anesthetics. Okay, so short-term memory is longer than working memory. However, it is not permanent. Most of the things you are hearing right now will go to your short-term memory, and I'm pretty confident it will not go to your long-term memory until you commit to read it again or listen to it again, in which it becomes long-term memory kapag na-store na siya. So long-term memory lasts permanently. It includes declarative and procedural memories. We have declarative and procedural. When we say declarative or explicit memory, it involves the retention of facts such as names, dates, places, as well as emotional undertones. Procedural, on the other hand, refers to how you did a task. Involves development of motor skills such as riding a bicycle. There's a process called consolidation, in which there is a gradual process of involving the formation of new and stronger synaptic connections. Okay, so being students, you need to learn how to use your memory, or how can you abuse your memory. Okay, ganito lang po yung kasimple para nakakatanda. If you hear it once, example, narinig nyo today, primarily it will go to your short-term memory. Okay, kasi you took time to understand it, it goes to your short-term memory. Working memory only works if alam ng katawan mo na hindi mo siya gagamitin for longer periods of time. Now, the challenge is how you're going to move things from your short-term memory to your long-term memory. Okay. Now, the thing with the brain is the more you use it or the more you think, the easier it gets for short-term to move to long-term memory. It's because pag short-term, you're going to exert effort to remember it. Okay? And the brain doesn't like exerting effort. Tamad din po yan. So, if the brain recognizes that what you are recalling tends to be used often, instead of storing it in short-term memory, it will move it into your long-term memory. Example, ang mga pangalan. you don't forget names of your parents or your siblings. It's because if the brain doesn't move it from short-term to long-term memory, your brain will exert more effort remembering it each time than putting it into long-term memory. Okay, we have several theories on memory, on how it can be abused and how you might want to influence how you store information. If you would like, I would recommend the gap learning, or parang gap memorization. So when we say gap memorization, pag sa ulo lang to, meaning it is raw memorization. You're going to see things in gaps. Okay. You're going to, example, may binrank up kang isang pangalan. Okay. If after 1 minute, you retained it, you're going to increase the gap when you're going to bring it up again. Example, 5 minutes. If it's still retained, or increase the gap again, like 1 hour. Okay. The longer time that goes by without you losing the information, the harder is your memory, or the harder your memory retains the information. Okay. However, if hindi mo na siya na-retain, example, nakalimutan mo na, you're going to go back. Okay, balik ka sa gap, tingnan mo ulit, then after 5 minutes ulit, tingnan mo ulit. Okay, this is very useful for things that require talagang raw memorization, like language skills. Hindi language skills, vocabularies. So if you're going to study different languages, this is very useful tactic to employ. Okay, next we have our limbic system. Coffee. So our limbic system includes the olfactory cortex, deep cortical regions, and nuclei. The limbic system is involved in memory, motivation, mood, and other visceral functions. Olfactory stimulation is a major influence for our limbic system. Okay, and then let's talk about meninges. Being medtechs, this will be very important to you. Meninges are connective tissue membranes that surround and protect our spinal cord and our brain. So it is parang a thin layer that protects or separates your blood from your brain. So meningitis is an infection of the meninges. It can be either bacterial or viral. Okay, so this is your meninges. We have different cerebri. We have different cranial meninges depending on the part. And you can slightly find the different meninges highlighted in blue. Okay, so we have different types of meninges, growing from superficial to deep. When we say dura mater, it is the most superficial and the thickest meninges. We have what we call the subdural space, which is the space between the dura mater and the arachnoid mater, usually only a potential space containing a very small amount of serous fluid. You have your arachnoid mater. It is a very thin wispy meninges immediately after the dura mater. It has your subarachnoid space, in which you have it is found between the subarachnoid mater and your PM mater. It's filled with CSF and contains blood vessels. So this is where you will get your cerebrospinal fluid for analysis. PM mater is the deepest meninges, a thin vascular membrane adhering to the surface of the brain and spinal cord. Okay, so you have your dura mater, which is the thickest. You have your subarachnoid matter, which is second to your dura mater, and which is directly attached to your nerves is your pia mater. An anterior view of our of our meninges. Okay, cranial subdivision. Okay, so if you're going to medicine, epidural space would be a very convenient place to learn. So the epidural space is within the vertebral canal between the dura mater and vertebrae. It is the injection site of epidural anesthesia of the spinal nerves, which is often given to women during childbirth. Okay. So when we also call subdural epidural blocks or spinal blocks. It is a temporary loss of feeling in the abdomen or the lower part of the body. Special drugs such as anesthetics are injected into the fluid of the lower part of the spinal column to produce loss of feeling. The patient stays awake during the procedure, and it is a type of regional anesthesia called SAB, spinal anesthesia, or subarachnoid block. Okay, I don't think you will be discussing this deeply in your pharmacology in the future if you still have pharmacology. However, short um, short explanation bakit hindi natin pinapatulog ang ating mga nanganganak na patients. It's because general anesthetics when given to pregnant women actually decrease muscle contractions in the uterus. So what happens is if you give our general anesthesia, mas mahirap manganak. Kaya ang ginagawa, instead of general anesthesia, we give local anesthesia to the epidural space, which paralyzes nerves. We prevent transmission of pain in the nerves. However, we do not block muscular action. So, hindi siya nakakaramdam ng sakit, pero gumagana pa rin yung muscle niya. So, pwede pa rin siyang manganak. Next, we have our spinal tap, also known as your lumbar puncture or your LP. It is a procedure in which spinal fluid is removed from the spinal canal for the purpose of diagnostic testing. It is particularly helpful in the diagnostic of inflammatory diseases of the central nervous system, especially infections such as meningitis. Here you go, the meninges of the spinal cord. Okay, next we have our ventricles. Ventricles are fluid-filled cavities in your central nervous system. So we have different types of ventricles. We have the lateral ventricle. These are relatively large cavities in each cerebral hemisphere. You have your third ventricle, a smaller midline cavity located in the center of the diencephalon between the two halves of the thalamus and connected by foramina or holes to the lateral ventricles. You also have your fourth ventricle. This is located at the base of the cerebellum and connected to the third ventricle by a narrow canal called your cerebral aqueduct, continuous with the central canal of spinal cord. Also opens into subarachnoid space through the foramina in its walls and the roof. Okay, so this is your ventricles. These are small spaces within your brain and usually contains your CSF. Okay. So let's talk about the cerebrospinal fluid. The cerebrospinal fluid is a fluid that bathes the brain and the spinal cord. It is unique to your central nervous system. It provides a protective cushion and around the CNS, and it is recognized as a third major fluid of the body. It is produced by your choroid plexus and reabsorbed in your arachnoid villi. The main functions is to collect waste, circulate nutrients, and cushions and lubricates nervous tissues. Your CSF flows from one part of your nervous system to another. So this is a useful mnemonic to remember from where it comes to where it is reabsorbed. Okay, So it is produced in your choroid plexus down to your arachnoid villi, where it is reabsorbed. Ilan yan? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so you might be familiar with this term. Pag malaking ulo, niloloko nyo yung inyong kaklase na merong hydrocephalus. Hydrocephalus is actually a serious disease in which there is a blockage in the openings of the fourth ventricle or the central aqueduct, causing cerebrospinal fluid to accumulate. If the fluid accumulates, especially in patients which has not hindi ossified yung bone sa skull, more likely mga bata, ang nangyayari, lumalaking ulo. Literal na lumalaking ulo. It's because the CSF enlarges the head and hindi siya na parang hindi siya ma-contain ng ating skull. Okay, it can be lethal if it compresses the brain tissue too much. It can be treated by placing a drainage tube from the ventricles to the abdominal cavity to eliminate high internal pressures. However, if bata bago nagka-hydrocephalus, usually irreversible na yan kasi hindi na babalik yung bone eh. Okay, we're almost done. We have our cranial nerves. So when kanina we have spinal nerves, nag-originate siya sa spine. Cranial nerves originate from your cranium. So we have 12 pairs, and these are designated by Roman numerals 1 to 12. They have a mixed categories of function, namely your sensory, your motor, and mixed. Okay, so these are all our nerves, our cranial nerves. So number 1, we have our olfactory nerve. Okay, it is only found within the brain. Next, you have your optic nerve. It is directly connected to your eyes. Next, you have your oculomotor nerve, which controls eye movement. Next, you have your trochlear nerve. You have your trigeminal nerve. Kaya siya trigeminal. It is subdivided into 3. Okay, so it is not, wag niyong isipin na sa face, nasa ilalim siya ng face. Okay, you have your 3 divisions of your trigeminal nerve. You have your mandibular, which controls the lower portion, which is your mandibles. Maxillary, which is near your nose, and ophthalmic, which is near your eyes. Next, you have your abducens nerve. And you have your facial nerves. This controls more of the mas pronounced siya compared sa trigeminal nerve. Mas malayo na narating. Next, you have your vestibulocochlear nerve, which is more likely connected to your ears. You have your glossopharyngeal nerve connected to your pharynx and larynx. So sa pag-swallow. You have your vagus nerve, which is important for digestion. Digestion. Yes, it is important for digestion. Afferent nerves in your stomach will report to your vagus nerve. And if there is vagus nerve stimulation, too much can cause vomiting. Next, you have your accessory nerves. Your hypoglossal nerves. And these are the different cranial nerves and their function. Okay, so I have read the quiz, and it would be wise for you to read this table. Okay, now let's talk about the infections and diseases of our CNS. First, we have our encephalitis. Inflammation of the brain caused by virus and less often by bacteria and other agents. Symptoms include fever, coma, and convulsions. Encephalitis is a more general term. Although pamamaga siya ng ng ulo, it is more specific to the brain. Meningitis, on the other hand, is specific to the inflammation of the meninges. It is caused by viral or bacterial infection, includes stiffness in the neck, headache, fever, and severe cases can cause paralysis, coma, and death. So in your near future, pag nag-bacteriology na kayo at saka virology or microbiology and parasitology, we will be discussing the causative agents of meningitis. Meningitis is dangerous. It's a dangerous infection because of its lethality and it's difficult to treat. Okay, if you move to pharmacy, meningitis is a very hard challenge to treat. It is very challenging to treat because of the very nature of our central nervous system. Mahirap maabot ng gamot ang central nervous system. Next, you have your rabies. It is a viral transmission by infected animals. Brain infection results in abnormal excitability, aggression, paralysis, and death. Tetanus is caused by your bacterial neurotoxins or our tetanus toxin. It affects the lower motor neurons in the spinal cord and brainstem, leading to muscle contraction. So, pag nag-tetany na yung patient, naglalak siya, naninigas na yung muscle. Mostly, it results to death kapag hindi na nagalaw ang inyong respiratory muscles. Next, we have our CNS movement disorders. These are the most common. When we say dyskinesia, it is a abnormality in movement. A group of disorders resulting from problems in your basal nuclei that results in resting tremors or jerky movements. Huntington's disease is a dominant hereditary disorder, causes progressive degeneration of basal nuclei characterized by involuntary movements. Cerebral palsy is a general term for defects in motor function or coordination due to brain damage by abnormal development. General symptoms include increased muscle tone, resting tremors, difficulty speaking, swallowing, breathing, aimless movements. Parkinson's is caused by a lesion in your medyo ano pala to, medyo non-specific. Caused by a lesion in your basal nuclei, characterized by muscle rigidity, resting tremor, general lack of movement, and a slow shuffling gait. So if you ever watched Love and Other Drugs, yung si Anne Hathaway in that movie has Parkinson's disease. Next, you have stroke. Stroke occurs when there is blockage of the blood vessels that give blood to your brain. It is dangerous because once blood fails to reach parts of your brain and the neurons then start to starve from oxygen, it may cause cell death. Pag namatay yung cell, it is hard to regenerate, which can lead to loss of speech, numbness, and paralysis. Alzheimer's disease is mental deterioration and dementia. Usually affects older people, involves loss of neurons in the cerebral cortex. Ito yung malala yung pagkakalimot. Symptoms include general intellectual deficiency, memory loss, short attention span, moodiness, disorientation, and irritability. Next, you have your Tay-Sachs disease, which is a metabolic disorder in which there is a lipid storage disorder of infants, which primarily affects formation of your CNS, and it includes paralysis, blindness, and death. Epilepsy is seizures. Epilepsy is the disease. The manifestation is your seizures. Seizures involve a sudden massive neuronal discharge, which may result into involuntary muscle contractions or your convulsions. So if your brain tends to become very hyperactive at one point in time, it will fire all at once, magdi-discoordinate ang inyong neurons, which may lead to convulsions. Okay, so finally, we have the effects of aging on the nervous system. In general, sensory and motor functions decline with age. It is only natural. Mental functions, including memory, may decline with age, but this varies from person to person. Usually, as long as you keep using your memory, it will take longer for it to deteriorate. Kaya po yung ating mga may mga scholars natin na may mga PhD usually, they retain the information because they still use what they learned on a day-to-day basis. Okay, and that is it for our nervous system.